Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we are on a mission to help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Rahul Dhingra with us. He, being a prominent oral surgeon and a maxillofacial surgeon, is being practicing since more than 10 years and is here to discuss with us the scope, opportunities about oral surgery, what a person can do after entering to oral surgery, what are the branches to specialize in oral surgery. So stay tuned for this amazing session. Welcome to the platform, and we are really happy to have you here to understand about oral and maxillofacial surgery from you and the scope and opportunities with that. So let's start with a brief journey of yours. How did you enter, and how did it all go around?
Thank you, Dr. Ayushi. Good morning and good morning to all our listeners. And first of all, I would like to thank you for inviting me on this special platform to discuss about the scope and opportunities in maxillofacial surgeries. And I'm Dr. Rahul Dhingra, private practitioner, and I'm graduated from King George Medical College, Lucknow. And later, after that, I have done. After that, I have joined the one of the most beautiful and decorated organization, Indian Army. And later on, I have pursued post graduation from Govt Dental College, PGIMS Rohtak. And since then, from 2011, currently I'm in my private practice. And during my post graduation, I have worked extensively over TMJ Ankylosis under the able guidance of my respectable guide, my mentor, Dr. Vinder Singh. And there also we have published prospective and retrospective analysis over TMJ Ankylosis. And for the first time in TMJ Ankylosis, we have used interposition of sternoclavicle graft with buccal fat pad lining, and it was widely accepted also. And we have published in American Journal of Oral Maxillofacial Surgeries. So now currently I'm in private practice at Rewari NCR region. I have my practice, I have my OT, and also I'm associated with many of the medical hospitals and doing consultations there.
Yes, yes. So nice to know about all of this, and as well as your research on TMJ and ankylosis and its publishment. It's really nice to know, sir. So now you entered into oral surgery. How did you pick up this branch, and why did you do that? What was your interest into it? How did you build that interest?
Well, I would like to say that first and foremost, it was my personal interest to become a surgeon. So, and also I feel that a phase come in life of many of the dental graduates when they are entering their clinical postings or when they are doing their clinical duties and when they are appointed in the maxillofacial department, and they see how the maxillofacial surgeons are performing, how is their setup, what was the pre-operative cases, and how they have turned to the post-operative results. So by all these things, a special kind of attraction that develops towards that branch. So same thing was with me. And apart from that, there were the many of the advantages or many of the merits I have seen with this branch. Like it is the interconnecting branch between dentistry and the medical field. So we are linked to many of the medical specialties like ortho, ENT, ophthalmo, neuro. And by doing this work, you are no doubt doing something different from routine dentistry. You are doing something different. And whenever you are performing the surgical cases, no doubt in any of the branch, in which of the branch you are performing well. But this was my wish to join as a surgeon. And apart from that, in this branch, there is one of the most important thing is there. It is a no doubt it is a small branch of dentistry, but it is a vast branch and having many of the subfields. And with this branch, the best part is that when a maxillofacial surgeon is doing this kind of work, So they have a better knowledge of the facial anatomy, surgery, as well as the occlusion, which is the drawback with the other branches performing maxillofacial surgeries. So these are the oral maxillofacial surgeon who know exactly what to do and how to achieve the occlusion, because you are achieving both function as well as aesthetics. That is the only outcome which you need. And being in maxillofacial surgery, it is a good part that you get referral from both the dental as well as the medical fraternity. And no doubt currently it's achieving the newer heights with the modern branches like in implantology. You can do much good work as well as in facial aesthetics, apart from its other fields like orthognathic and TMJs. So no doubt, because of all these merits, I was willing to choose this branch, and no doubt I'm loving it.
I'm sure, sir. So now when you mention about different branches in the oral surgery,
Right.
TMJ, orthognathic, what are the different kind of branches that a person can specialize into, if you can mention all of those?
See, specialization in oral maxillofacial surgery, there is the further subdivisions of this branch is there. As I have mentioned that it is a very broad branch. Basically, we can divide it into two parts, like minor surgical as well as the major surgical. In minor surgical, it ranges from simple or to complicated exodontia to space infections to biopsies or small of the cyst. But when we come to the major part, major surgical cases, then it is divided into like the maxillofacial trauma. In maxillofacial trauma, we are dealing with the maxillary and the mandibular fractures, and we are managing by means of intermaxillary fixation, in which mouth is closed for 4 to 6 weeks, or by means of open reduction and internal fixation. Most of the time, we use monocortical plates and sometimes reconstruction plates also. And sometimes we use plating as well as the IMF in many of the cases. And apart from trauma, there is orthognathic surgeries. Orthognathic surgery is being done for the development of dentofacial deformities. Like you might have seen many of the patients with the maxillary or mandibular excess, or suppose there is mandibular prognathism is there, or retrognathism is there. Same thing happens with the maxilla. There can be maxillary excess is there, or maxillary deficiency can be there. And sometimes the in bimax protrusion is there, or facial asymmetry is there. So it is the oral maxillofacial surgeon who correct them, because they are the some of the various phases of treatment in this orthognathic surgeries. Initially by the growth modification, orthodontic camouflage, but when age is completed for the growth, then you need orthognathic surgery only to correct the alignment of the jaws. And no doubt, I have seen that these patients are no doubt functionally and aesthetically disturbed, but also they are suffering from some psychological trauma because the acceptance by the society. So by treating these patients, you fulfill all the goals, function, aesthetic, as well as sociological acceptance of them. And apart from that, next come the TMJ, temporomandibular joint. There can be temporomandibular joint derangement. You might have seen many of the patient comes with clicking, and they are not able to chew, or and many of them are running here and there to many of the specialties and taking antibiotic and analgesic, and without any results. So in maxillofacial surgery, we can treat them by conservative means or by means of the arthrocentesis. Or arthrocentesis, I would like to say that it is a small procedure, but with very promising and very good results. And apart from that is surgery. And in case another is the TMJ, like you might have seen many of the people who cannot eat or who cannot open the mouth due to the fusion between the condyle and the glenoid fossa. So TMJ ankylosis, it is also no doubt one of my favorite field is there. And by managing this TMJ ankylosis, we manage them to open mouth and to chew normally. And apart from that, there is a congenital defect, like we can say cleft lip and palate, when there is separation between the lip and separation between the palate. And these are also managed in the early stages of life by maxillofacial surgeons. And then there come the neuralgia cases. There can be trigeminal neuralgia, which is a very painful condition, and myofascial pain disorders. And
Hmm.
I would like to say that maxillofacial surgeon can distinguish adequately between what is the TMJ pain, what is trigeminal neuralgia pain, and what is the myofascial pain disorders.
Hmm.
So, because I have seen in many of the times in routine practice, those cases which are with the vague pain, they are classified like neuralgic pain. But it is not so. Only I have seen 10 to 15% of the actually neuralgia, while rest of them are like myofascial pains. So
Correct.
it is the duty, and it is our duty to distinguish and treat them.
Hmm.
Next come in oral surgery is the onco part, because in head and neck cancer, oral surgery is the most predominant site
Hmm.
of carcinoma, and most often 92% of the cases that squamous cell carcinoma is there. In maxillofacial surgery, what we do, depending on the need, like resection, hemimandibulectomy, or partial mandibulectomy, or maxillectomy is there, and then rehabilitation by means of various soft or hard tissue graft or vascular graft also.
Hmm.
So these are the various fields in which a person can specialize. Apart from that, if I would like to ask for implants, which
Hmm.
is currently is the most fashionable or most recent or most contemporary branch, and in this implants, it is quite easy for an oral surgeon to perform all kind of surgeries, because they are well versed with the maxillary sinus. And I can say that currently the zygomatic implants or pterygoid implants, it is a big thing for many of the people. But
Yes.
being an oral surgeon, you are dealing daily on this, every second day you are dealing with a zygomatic bone or pterygoid bone, so it is not a big deal for you.
Correct.
See, and apart from that, if we come to the facial aesthetics, apart from technical capabilities, you are
Hmm.
also legally capable of performing all these facial aesthetics procedure like fillers and Botox or hair transplantation. So
Correct.
these are the various subdivisions where an oral surgeon can excel in any of the field.
Correct, correct. And actually there are so many wide branches that if you pick up one, as you mentioned about yourself as TMJ ankylosis, you
Yes,
can
yes, yes.
actually become a specialist into that and can get hired by really, well-known hospitals and become a surgeon there. So this is really nice to know.
Definitely, it is the branch, also is the only branch where you can pick a subdivision and you can excel in that. And
Correct.
also you can get assistance from various specialists like
Sorry guys, there is the internet just hung up. We need to wait for 2 minutes. I'm sure Dr. Rahul will be back. Yes, sir. We actually lost you. So,
Okay.
so we were at, this is the only branch where we actually can specialize. Hello? The internet is not playing well today. It will take just 2 minutes. I hope he will be back again. Yes, sir. We lost you again. So if
Okay, no
yes,
issue.
if you can repeat again, that you just mentioned that this is the only
Uh,
branch where people get
okay.
specialized.
What I was mentioning, that the good part with this maxillofacial surgery branch is that it is the only branch where you can excel, or you can do specialized practice, you can do specialized maxillofacial practice, or you can even excel in any of the subdivisions.
Hmm.
See, if you want to do orthognathic, you could be busy in orthognathic surgeries only. You can be busy in maxillofacial trauma. You can get attached to trauma unit of the hospitals or the government or the private hospitals,
Correct.
and you can be a part of the onco team and
Correct.
performing with association of them, with the association of onco surgeons, or you or
Hmm.
plastic surgeons and radiotherapy team, you can perform well about in case of the onco surgeries. So it is a
Hmm.
great part to be in this branch, that you have a vast majority of the opportunities.
Correct, correct, correct. That's so true. And this branch helps it to be different than other of the specialized branches in dentistry. That differs.
Definitely, definitely.
Yes, yes. So now understanding about these sub branches, if somebody finishes the MDS in oral surgery, what is the way of establishing himself or herself?
Okay, thank you. I think that this is a very nice question, and which will help many of the budding surgeons and those who are already in practice. Because I have seen many of the times we come to know about the things later on when we have passed on our post graduation, and later on we realize that this was the needed, and if we have done this in the early of after completion of our post graduation, then it could have helped.
Correct.
So I would like to say that for the surgeons who are willing or who are doing their maxillofacial surgeries currently,
Hmm.
it is very important for them to first select that in which subfield they want to excel, in which subfield, which is their particular kind of interest. Because I have seen that it is not very much possible for a single person to master all the subdivisions, like to master ankylosis, TMJ, master orthognathic or onco. So no doubt, if there is any of your particular interest, you must choose it. And then after completion of your post graduation, you must see for the SRship or fellowship in the concerned department where the cases of your interest are there. And
Okay.
after joining your fellowship or SRship, because 3 years time is not enough to understand this branch, and
Correct.
fortunately we are lucky enough that we are getting this maxillofacial surgery degree in 3 years, while it is not possible to get this degree in most of the countries. I think India is the only country where we are getting this degree in 3 years. Like even
Hmm.
our adjacent countries, it is a 4 to 5 years program. And if we ask about overseas, then it is a minimum 4 to 6 years program. Oral surgery program is there.
Correct.
So you, after completion of your post graduation, you need to do for 1 or 2 or 3 years SRship or fellowship. And once you're completed with
Hmm.
your fellowship, then you can perform the surgeries in government or private setup. Initially, you can take help of your senior fellows. And if you are coming to
Yes.
the private practice, it is of utmost importance that you must have your own OT complex where all of your needs could be met. And apart from
Hmm.
that, you should have one or two your personal OT assistant, because whenever you are who will be assisting you at your center as well as the other centers. And because I have seen when you go to the other center and other people, other OTs are assisting you, they are not very much capable of assisting your surgeries. So because in oral surgery, you are doing very precise work, and it become
Hmm.
very easy when you have your personal assistant is there. And apart from that, you must be connected with the journals and workshops or conferences, because it is a learning curve. If you want to excel in your field, you
Hmm.
must always be in a learning phase. That would be always better.
Correct.
So these are the points by which that person can select, and it will be helping them
Hmm.
to associate or to run their practice.
That's true. That's true. All of these points are really nice to know and are very important. So
Thank you. Thank you.
yes, so now when you have mentioned how to establish oneself in India, because if somebody wants to move outside India, what is your suggestion for those students?
See, if somebody want to go outside, एक मिनट थोड़ा सा उनको ना वो करवा देना if somebody want to go outside, then I can say that first this is the same thing. People should recognize that where they want to go, and they can prepare for those sites earlier. Okay, if they want to go outside, people can do fellowship here, as well as they can go in the residency program outside. Okay, and
Okay.
but in most of the overseas countries, like in Australia or UK, they need BDS as well as MBBS degree. Okay, if you want to come
Hmm.
in oral surgeries program. And overseas, I have
Correct.
seen that oral surgery is broadly divided into two parts. One is the dental surgery part, in which they are called oral surgeons. And
Yes.
one is like the actually maxillofacial surgery. For maxillofacial surgery, they need a medical degree as well.
Correct.
Okay.
Correct.
And suppose if I would like to talk about Canada, then you need, because we are in a non-accredited, we are from non-accredited dental schools.
Yes.
Actually, our degree is not straightforward accepted there.
Yes.
So there are the two ways. Either we can go to degree programs, or we can go through specialty exams programs. If
Hmm.
so, there is one of after your there is a comprehensive program.
Okay.
By means after your credential verification, you write
Hmm.
down assessment of fundamental knowledge exam.
Okay.
And once you have cleared this exam, then you can go to the either degree program, or you can go to assessment exams. There is a assessment of clinical judgment, assessment of clinical skills. And once you have cleared
Okay.
these exams, then you can write down National Dental Examination Board exam. And then you can come
Hmm.
to the oral surgery specialty. And another
Okay.
method is coming to your direct specialty by writing your dental specialty exam. But it is a bit difficult for we people, because they accept
Hmm.
oral surgery with 4 years curriculum, while at our side it is
Okay.
a 3 years oral surgery program. So it depends in which
Yes.
country you want to go. But the most important thing, one
Hmm.
thing I would like to add, if people want to join some of the country, people want to serve there, then some of the prerequisite is there. Like you can clear your IELTS exam or English exam or GRE or TOEFL exam during your oral surgery MDS is going on.
Okay.
So
Okay.
it will save some of your time.
Hmm. 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 Yes. Yes. That's really nice to know about how to settle down outside India. Are there any kind of fellowships, or any kind of courses that you can suggest for an oral surgeon who is practicing here in India to upgrade his skills, to understand about the some of the knowledge that is being practicing outside?
Definitely, there are the many of the fellowship programs currently running in India and outside.
Okay.
If I talk about our Indian programs, our Association of Oral Maxillofacial Surgery, they are running many of the fellowship programs. They release the number of, they have actually many of the colleges, they have recruited for fellowship programs. The fellowship is in trauma, orthodontic
Hmm.
surgeries, or oncosurgeries. So people can write down their exam. The procedure is either by exam, or most of the time it is by exam, and on the merit basis you are given the departments that like those who are interested in trauma fellowship, those who are interested in
Hmm.
orthodontic fellowship. So they can write
Hmm.
down their exam, and then after doing the fellowship, they also need to give exam and satisfy at least 50 to 75%, so that they can excel in this field. So, and apart from
Correct.
that, there is a cleft lip program is there. People can join
Hmm.
like charitable organization, American charitable organization, Smile Train organization is here, and another is
Hmm.
Operation Smile, in which they are with you for the cleft lip palate surgeries. Okay, so people can get
Hmm.
attached with them and learn the skills and get fellowship under their guidance. So these
Hmm.
are the ortho, onco, trauma, and cleft lip palate. Apart from that, if we talk about international, then International Association of Oral Maxillofacial Surgery, they also run the fellowship program from time to time, and
Hmm.
criteria is same like the merit basis. And during that fellowship also you get a handsome stipend, and you can work with the internationally famed surgeons, and you can have
Hmm.
experience of them.
Hmm. 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 That's really nice to know, to understand and to learn despite practicing here. So now when you have suggested about how to establish what are the courses and the fellowships a person can go for, what is it, that you will suggest any oral surgeon, very frank opinion from your end, that you think every oral surgeon should understand from his end to his to establish and to be a better practitioner?
See, first thing, for any of the oral surgeon to establish or to excel, you should be very clear about your interest from the very beginning. It will help you rather than straightforward going to practice and then returning back and then realizing, no, I was not no, I was not willing to do this. Actually, I want to do this. So you make it clear that
Correct.
what you exactly want to do.
Correct.
Okay, after that you choose your particular field of interest, and and then you need to start your journey.
Hmm.
And no doubt, if I would like to say that this branch, no doubt it is a very excel branch, and you can, it is very viable to do your specialized practice
Hmm.
in this oral surgery. And
Hmm.
apart from that, there are the great job opportunities you can see in many of the hospitals. You can get attached to the hospitals, and no doubt, apart from all these respectable branch, your skills, your clinics, and no doubt, it is a very good earning branch, because oral surgery work is the one of the highly paid work, I would like to say. So nowhere you are financially stable always, most of the times. And when you see your results, when you see how the patient came to you, and what was the preoperative condition and how you have managed it, and now how the patient is, all your results give you a motivation to excel in your field.
Correct.
And last and the most important thing, that you should be honest with your profession. After every surgery you should ask yourself that what was the need, whether I have done right, or any of the improvement was there. So by doing this, no doubt you can excel in your field, and nobody can stop you. And no doubt it is a learning phase. So these are all the things that I would like to say, that it is a very good branch, very lucrative, and no doubt a pleasure giving branch to you. So these are all kind of things I would like to say.
Hmm. 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 Thank you so much, sir. I'm sure it would have been so inspirational for the dental surgeons to understand about oral surgery, a branch which is anyways a mainstream branch, but still to understand what is really inside the branch, what are the opportunities that you can look forward to if you pick up this as your specialization branch. And I'm sure after listening to your discussion, it would have been even more clearer to understand and to know how vast and how big this branch is inside and where all you can see yourself establishing. Thank you so much again for joining us today, sir.
Thank you very much, Dr. Ayushi. I would like to thank you, and also it is the motto of this platform, like you have already explained that, and I feel that with my 10 years of experience in my private practice, it could have helped to the young budding surgeons to plan their journey and to excel in their field. And again, I'm really thankful to you for inviting this platform
Yes,
to actually to know about the scope and the opportunities of this maxillofacial surgeries. Thank you very much.
exactly. Thank you so much, sir. We are also very grateful to hear you on this topic. All of you who all have joined us today in this interesting session. I'm sure it would have been really insightful for all of you to understand about this branch, why you should pick up oral surgery, what are the scope and opportunities, and how can you look forward for your future with the branch. Do share it with your friends, colleagues who are planning to go for their masters or are planning to pick up oral surgery as their specialization branch. It will be really helpful for them. Also, do follow us on our Instagram and YouTube channels. There you can find all our old videos, which can also help you with your career growth. Thank you so much, everyone, for joining us on this Sunday morning. I hope it must have been a really helpful session for you. Thank you so much, Dr. Rahul, for joining us again. Yes,
Welcome, Dr. Ayushi. Thank you very much to all our listeners
yes,
who could have been taking some of the tips along with them.
correct.
And thank you very much. Thank you to the social doctor platform. Thank you
Yes.
very much.
Thank you, everyone. Okay. Bye bye. Bye bye, everyone.
Bye bye.